Okay. So you are free to take it away. I'll give a little bit of an intro first. This is Dr. Jeffrey Jenks. The what was your title again from over at Public Health?
So yeah, the medical and laboratory director.
There you go.
At the Durham County Department of Public Health, and you know, this can be very informal. You know, I'm hoping that there are some lots of questions here. You know, that I can you know, do my best to answer. But I'll give a brief introduction to, you know, to monkeypox, just so, you know, we're all kind of on the same page to start with. Before I forget, I want to share my screen and just put a plug in. There's Duke Health is having a vaccine event tomorrow. I don't know. Can you all see this? See the flyer?
Yes.
Okay. And maybe if Hunter, if you don't mind, or Alex can get this out on social media if you think it's appropriate. Yeah. But I just want to make sure that, you know, everyone's kind of aware that if you're after, you know, we talked this evening, if you're interested in getting vaccinated, you can come down to the health department, but this is another event, another option tomorrow. They are asking for you to schedule in advance, just so they kind of can know how many people are coming and make sure that things run smoothly. But so this is happening tomorrow, 8 to 4:30 at Duke Health, 1400 Maureen Road. So I just wanted to make sure I put in that plug before I forgot to do that. And so, you know, just to kind of make sure we're all on the same page, just want to talk just for a few minutes about, you know, kind of monkeypox, describe it a little bit and kind of what we know about it. And then there are a few questions that were sent in anonymously, and I can answer those. And then I wanted to just open this up to y'all to ask any question that you want. There's no bad question. So I will do my best to answer any question that you want to throw at me. I can't guarantee I'll have the answer, but I'll do my best. So a little bit about monkeypox. It's a virus that's been around for a while. So it was first discovered in 1959 in animals, and the first case in people was discovered in 1970. So we've known that it causes infections in people, you know, at least for the past 50 years. Now, most infections have occurred in Central and Western Africa. So it is endemic there, meaning that it causes kind of predictable infections. There have been some epidemics or outbreaks in other parts of the world. So in 2003, there was a small outbreak in the United States. That's the only outbreak we've ever had here. So it's not a completely foreign virus to scientists around the world, including those in the United States, but we don't typically have to deal with it much unless, you know, typically what would happen for an American is they would travel to a place that's endemic and they would get infected there. Or as occurred in the 2003 outbreak, that was thought to be due to some animals that were imported from an endemic region. So there was kind of a shift in that people that bought those animals, some of those people got infected. Typically, it causes infection in children, and it's due to, you know, close contact, you know, with other kids or other family members. In May of 2022, so this year, cases started occurring in Europe. The first case in this current outbreak occurred in the United Kingdom. And what we've seen with this recent outbreak is things are behaving a little bit differently. It is occurring in, or it is being transmitted from close skin-to-skin contact. So that's not new, but what is new is that the vast majority of cases have occurred in men and have occurred in either men who have sex with men or transgender individuals. And that's what's different about this current outbreak. So traditionally, there are two kind of clades or variants of this virus. There's a Central African clade. That's the variant of the virus that's endemic in Central Africa. And then there's a Western African clade. That's the variant of the virus that's endemic in Western Africa. And there's a little bit of controversy now. Is this current outbreak from the Western African clade? It's kind of behaving that way, particularly regarding how severe the infections are. Or is this even a new spinoff, kind of a new clade, like a third clade that we're seeing now? There's some debate about that right now. So it's not there's no kind of conclusion. This current outbreak is behaving differently than what we've seen this virus, how we've seen this virus behave. It's spread by close skin-to-skin contact, so contact particularly with these lesions that tend to hold a lot of virus. And so when I say close skin-to-skin contact, I'm not talking about like someone brushing up against someone else. We're talking about close skin-to-skin contact for minutes, 6, 8, 10 minutes. It is possible to get the virus other ways. And so there have been a handful of cases from people that have acquired it, and it's not thought to be due to sexual contact. So there was one case that someone who was changing linen from someone that had monkeypox. It's thought that they may have acquired it that way. And so if there was, scabs from lesions in that linen, that it's possible to be transmitted that way. That is not the typical route, and that's pretty unlikely, to occur that way. So it's mostly close skin-to-skin contact. To date, there have been, I think, around 15,000 cases globally, and there's been about 9,500 cases in the United States, including about 115 cases in North Carolina. And the cases in North Carolina are predominantly men who have sex with men, and about 70% of cases are in people who identify as Black or African American, which is a little bit different than kind of what we're seeing nationwide. Nationwide, the infections are more lighter in people who are white or Caucasian. The good news is there's a good way, to prevent this. We have a vaccine, JYNNEOS, that's been around for a few years. And it is, I'll talk a little bit about kind of how effective it is. That was one of the questions that we got sent, but it is very effective. And, there are multiple ways you can get it in Durham County. So at the Durham County Department of Public Health, we are scheduling appointments and vaccinating 5 days a week. So that's one way to get vaccinated. Duke is vaccinating in their clinics. UNC has been vaccinating. There are maybe a couple other ways in the near future. Lincoln Community Health Center, I believe, is going to start vaccinating. So we've got a good effective vaccine, which is very effective at preventing infection. And then there are some treatments for folks that have developed really severe disease that are available through the Centers for Disease Control and Prevention. So that's just kind of a brief overview of monkeypox, and I'm happy to answer any specifics that you have about kind of how what symptoms people have, the kind of the the epidemiology, what sorts of people we're diagnosing the infection in, whatever questions you have. But first, let me start just with the few questions that got sent in. So one is, are there any studies that can confirm if the chickenpox vaccine given in Mexico can provide some form of protection against monkeypox virus? So unfortunately, the chickenpox virus, although that is a pox virus and it belongs to the same genus or very close group as the monkeypox virus, there's unfortunately no kind of cross protection between getting the chickenpox virus and getting monkeypox. So the chickenpox vaccines don't provide any protection. The smallpox vaccines do provide some protection, and that's why one of the theories why people thought we haven't been seeing so many cases, because back in the 60s, 70s, a lot of the world was getting the smallpox vaccine, and that was probably preventing a lot of monkeypox cases. Smallpox has now been eradicated, and globally we've stopped giving the smallpox vaccine as of about 1980. So a lot of the people that had gotten the smallpox vaccine in the past have either died from other reasons or have the immunity from that smallpox vaccine. The protection from the smallpox vaccine has worn off, and that's one reason why we may be seeing more cases now. So unfortunately, the only vaccine that can prevent monkeypox, aside from the two available vaccines, is the smallpox vaccine, and that's no longer available. I should mention, aside from JYNNEOS, there is another vaccine that's available, ACAM 2000, which tends to have more side effects than the JYNNEOS vaccine. So that is not the preferential vaccine to give, just because it can cause more side effects. But that is also available. So that was the first question. The second question, and that's a good question. Second question is a good one too. Do you recommend immunocompromised people, especially positive? I think the questioner meant HIV positive people, but I'm not sure, to get the monkeypox vaccine. And the answer is yes. So the JYNNEOS vaccine is although it's a live vaccine, it is a live but non-replicating vaccine. So it is not possible to actually get monkeypox from the vaccine, because the vaccine has virus in it, but it's not able to replicate or make more of the virus inside you, and so it cannot cause infection. And so even if you're immune compromised, you should, it's a good idea to get the JYNNEOS vaccine. Now, like all vaccines, if you're immune compromised, you may get less bang for your buck, just because you don't have as strong of an immune system to develop immunity against the monkeypox virus. But that still doesn't mean you shouldn't get it. It just means you may get less bang for your buck. But I would still recommend getting the vaccine if you're immune compromised. So the third question is a very good one, and there's a couple parts, so I'm gonna break it down a little bit. So can you acquire monkeypox after the vaccine? So it depends a little bit on what we're vaccinating for. So if we're doing post-exposure prophylaxis, so let's say you've been exposed to someone with monkeypox, and you're saying, oh man, I think I was just exposed, I want to get vaccinated as soon as possible. We know that if you're vaccinated within 4 days of getting exposed to someone with monkeypox virus, that is very protective against preventing you from getting monkeypox, so developing symptoms, getting sick. If you get vaccinated between 4 to 14 days of being exposed to someone with monkeypox virus, it's not as good at preventing you from getting sick, but it can help prevent your symptoms from being severe. So kind of like the COVID vaccine. So that's what we call post-exposure prophylaxis. You've been exposed to someone with the virus. Now we're trying to prevent you from getting sick. As far as like pre-exposure prophylaxis, so you're vaccinated because you think, I'm high risk for getting sick, I want to make sure that I'm protected as possible. There's less good data there. I've not seen any papers or any data that people have gotten infections, once they've gotten 1 dose or 2 doses of the monkeypox vaccine and then gotten exposed. It's probably possible though. And as far as post-exposure prophylaxis, so you've been exposed and then you've gotten vaccinated, yes, there's definitely some documented cases of people then getting monkeypox, but their infections tend to be less severe. So that's one part of the question. The second part, if so, does the vaccine reduce duration of monkeypox infection and/or severity of symptoms? So I don't know if it reduces the duration of your symptoms, but it does reduce the severity. It can reduce the severity of your symptoms. And probably, although I'm not sure about this, it probably can reduce the potential for you to spread the infection to others. There's not any data there to kind of back up what I'm saying, but if you've got some vaccine in your system, then you've probably got, your immune system has a head start, and it will probably reduce the amount of virus that you have in your body capable of transmitting to other people. And then the last part of the question, this is a good question. What's the probability of spreading monkeypox at 1 week, 2 weeks, 3 weeks, and then a month after getting the first vaccine and the second vaccine? So we don't know this yet either. The clinical trial for the JYNNEOS vaccine looked at kind of on a vaccine. There's two ways to go about that. One is to look at to do kind of what the COVID clinical trials looked at, the COVID vaccines. So I take a group of people, I vaccinate them with the vaccine. I take another group of people, I don't vaccinate them, and then I follow both those groups, and I see, okay, how many people ended up getting COVID? So to do a clinical trial like that, you need thousands and thousands of people. So the COVID vaccines enrolled 20, 30, 40, 50, 60,000 people. And you need enough virus, in this case, kind of in the community where you're kind of going to ensure yourself, okay, I'm going to have some infections in 3 months, in 6 months. When the company that developed JYNNEOS did the clinical trial, monkeypox was not spreading in the United States, and so they couldn't do that clinical trial. So they had to do a second type of clinical trial, and instead of looking at people that got the infection, they looked at, okay, what are people's immune response against the vaccine? And so that was what we call their endpoint. And so they looked at immune response at 2 weeks and 4 weeks and 6 weeks after 1 dose and 2 doses of the vaccine. And so after 1 dose of the vaccine at 2 weeks, I think they found that about 93% of people had a good immune response to the vaccine. And so that kind of leveled off at 2 weeks. And then at 4 weeks, they vaccinated. They gave the people in the clinical trial the second dose. And then they measured the immune response again 2 weeks after that. So at a total of 6 weeks from the first shot. And they found that about 100% of people had a good immune response. Now, that doesn't mean that the vaccine, that 2 doses of the vaccine is 100% protective. That just means that, at least in the clinical trial, every single person that got 2 doses had a good immune response. So I can't, entirely answer the questionnaires question, but I can say that 1 dose of the vaccine seems to be pretty protective. Most people get a good immune response, and that 2 doses of the vaccine is very protective. But again, going back to was the first question, it's not going to probably be 100%. Most vaccines aren't. So some people are going to have some breakthrough infections, but this is a good vaccine, and it's a safe vaccine. So those are the questions that we got sent in ahead of time. I'm happy to answer any questions from the folks on the call that have come up since I started talking, or maybe some questions that you had coming in. I didn't realize I talked for about 20 minutes. I didn't mean to do that. So I'd love to have some questions.
It's really okay. And if folks don't feel comfortable asking questions with their mic turned on, you can either submit it in the chat to the group, or you can send it individually to myself or to Dr. Jenks.
What are some symptoms of an infection?
Yeah, so it's a good question. So it varies. So, if you kind of look at, all people that have gotten gotten monkeypox, I will say that it's not uncommon to get kind of flu-like symptoms. So headache, muscle aches, chills, those are pretty common viral symptoms. Most people, so I'd say maybe 50–60% of people during this current outbreak have had fevers and enlarged lymph nodes. if you look at past outbreaks, almost every single person who gets monkeypox has fevers and enlarged lymph. So that threw us off a little bit a couple months ago, because we were expecting everyone coming in to have fevers and enlarged lymph nodes, and we weren't necessarily seeing that. But those symptoms are common. The one thing that everyone has is a rash. And so typically you'll get kind of flu-like symptoms, and then maybe fever, enlarged lymph nodes, and then a couple days after that, you'll get a rash. And so the rash can look very differently depending on who you are, but kind of classically, it's a flat rash, a viral rash, and so it can involve red rash involves a lot of the body, and then that will generally evolve classically into these raised sores that have a little dimple in the center, kind of like a chickenpox lesion. And classically, those raised lesions occur all at once. Now, with this current outbreak, that's not necessarily what we're seeing. So we are seeing either a rash or these raised lesions, but oftentimes it doesn't involve the entire body. It may involve just one part of the body. So one place that we're seeing these raised lesions quite frequently is in the genital area, where there's the skin-to-skin contact. There may only be one lesion, and it may be very unimpressive. And so, what we're finding is we need to have a high suspicion looking for either a rash or those lesions, kind of if we're concerned about monkeypox. So when you Google, pictures of the monkeypox lesions, especially pictures that occurred prior, were taken prior to May of 2022, that's not necessarily what we're seeing. Sometimes these raised lesions are really not super impressive. And so any raised lesion, especially if it has a kind of dimple in the center, or it's got what we call it's a pustule, almost like a pimple, in the right context, that makes us suspicious. Again, and we're seeing a lot of these kind of in the genital region, but they're anywhere. So almost always you're going to see a rash, and then oftentimes folks will say will have had fevers or enlarged lymph nodes a few days prior to the rash appearing, and then they can have a smattering of other symptoms. Another thing that we're seeing quite a bit is rectal pain for folks that engage in rectal intercourse and bottom, because that's where they're getting lesions, and you may not be able to see them. So that would be kind of the most common symptoms that folks get. I hope that answered your question. Okay. Can you catch monkeypox from surfaces? Is there a different level of risk between hard and soft surfaces? So previous outbreaks, it's 4 days to 14 days or somewhere around that region. There definitely is an incubation period between exposure and the development of symptoms. And then once you get symptoms, you can have them for anywhere from 2 to 4 weeks, and that's the time where we ask people that have these lesions to isolate at home, because that's when they're infectious. We're not sure if during the incubation period you're able to transmit the virus or not, and we're not even sure if you can transmit the virus when you have symptoms but you don't have a rash. It may be that it takes that period of once you get the rash to be able to transmit the virus, because we know that there's lots of virus in these lesions. So you're infectious, at least what we know of this thus far, you're at least infectious from when the rash appears until when those lesions are scabbed over, the scab has fallen off, and there's healthy skin where those lesions were. And that's when you're no longer infectious, and that's when we clear people from does the county have access to TPOXX? That's the kind of the main treatment for monkeypox. We do indirectly, so we can get it through the North Carolina Department of Public Health, and they are getting it through the CDC. They may actually have some TPOXX on stock now. I'm not sure about that, but we are getting it from them. So it wouldn't be too hard. If we needed to get it, we would just request some from them. But you can't prescribe TPOXX right now. So like I as a doctor couldn't write a prescription for it. It's got to come through, either through the state or the CDC right now. But it's pretty easy to get. I don't see any other questions in the chat. Any other questions that anyone has, or questions that I didn't answer or incompletely answered? The other thing I'd be happy to, we can talk about, if anyone's hearing or reading about some, kind of rumors about monkeypox on social media, you can ask anything to me, if there's kind of a rumor you want dispelled, or you're wondering, is this true? Please ask away, because there is some misinformation kind of circulating on social media. So I want to make sure I, answer any question that you got. The other thing I meant to mention earlier, and this is something that's come up, kind of coming up in the media, is, why this is occurring primarily in the MSM and transgender community. And I think that's a good question, and one we don't entirely know now. But what I think I can safely say is there's nothing about this virus that makes it, makes someone that's a man who has sex with other men, or a transgender person, makes them uniquely susceptible to this virus. I don't think that's the case. What I think is this just happens to be transmitting, mostly within sexual networks in this community, but there's no reason to expect that it won't, we won't start seeing it more outside of the, the relation of these sexual networks. So I don't think there's there's no biological reason, or any great reason why we're seeing cases primarily in this population. It's just, this is kind of, these are the networks it's transmitting in now, and I think that will change. Well, if there's no other questions, I'm happy to, I can let you go.
I'm not seeing any more questions coming through on my end either.
And did we get the, I'm not the most technologically savvy person. Did we get the QR code in the chat, or for the Duke event tomorrow?
Yeah, I shared the screen, and let's see, I'm gonna try and share the file. Looks like I am struggling to do that right now, but I can email that to folks, and we'll have it on our social media as well.
Okay. Okay, cool. All right.
Oh, wait, we have a link. Hold on.
Okay.
This is Todd.
Yes.
Todd Mormon. I just wanted to return to the TPOXX question. Given how painful I've heard this can be, and given that TPOXX does seem to help, I'm just wondering if there's any kind of push to get the CDC or the DHHS to make it more available, so that people don't need to know, first know it exists, which they may not, and second, advocate for themselves to actually get it by asking for it, instead of having it be something that doctors can prescribe. Is there any kind of push to change that, so TPOXX doesn't have to get CDC approval to be approved each time?
Todd, it's a great question. I don't know. I don't know the answer to that off the top of my head. And we've actually not had, like, I've not had a case where, or I've not even heard of a case where, in our area where someone's needed TPOXX. So I just haven't gone through the process yet. So I don't know. I don't know. I don't have a great answer for you. I think it. Obviously, if the availability is there, we'd like to, the more available, the better. Just like with Paxlovid and COVID, for instance, there was a big push, with the federal government to let's make this available in every street corner we can. So, we reduce the barriers to people getting access to Paxlovid. And I think that's been very effective. Now, it may be a supply and demand issue. I don't know. I think it's a good question. And I can look into this a little bit more, but I don't know. It'd be great to see though. Okay. Honor, that may be it with the questions.
And that's okay too.
Okay.
But yeah, thank you very much for everyone taking time out of their evening to attend. If you have any further questions, please feel free to reach out. I think my email address was included in the invitation.
Now I'm going to put my email in here too. You can feel free to reach out to me. Whoops.
So there's opportunities to email either of us, as well as there's the vaccine pop-up tomorrow with Duke, and we're looking at organizing some with the center and public health. So when that information becomes available, we're more than happy to share that across our social medias.
And then I mentioned this at the beginning, but for folks that might have jumped on late. So we are vaccinating at the Durham County Department of Public Health, 414 East Main Street, Monday through Friday. We are asking that you call and schedule an appointment. I don't know, Alicia, do you have the number handy? If not, I can find it to put in the chat. But we love, if you're interested, please, thank you, Alicia. Yeah, please give us a call and we'll get you on the schedule. We want as many people are interested and, kind of candidates for the vaccine to get vaccinated because it's so protective. Okay, well, feel free to reach out to me with any questions.
I did have one question.
Sure.
So I think I saw yesterday that the FDA planned to split the doses into 4 or 5 doses sublingually or something like that instead of the 2-dose regimen. I was wondering if the Durham County facility would continue giving the 2 doses, or are you planning to do the reduced or do the 5-dose regimen?
Yeah, that's a good question. So this is the typical dose is a subcutaneous dose. And so that's 1 dose and then a second dose 4 weeks later. There is some data from a paper published a few years ago that you can do a intradermal dose with a 1/5 of the dose of the subcutaneous. So a 1/5 of the amount. And that, what this paper showed is that gives you equal kind of equal effect to your immune system is the subcutaneous dose. So potentially, if you do the intradermal, you can get the same bang for your buck, but get 5 doses out of 1. And so the North Carolina public is looking at the utility of doing this. And once they determine, it's doable, we will likely start doing it down at the county, just so we can potentially vaccinate more people. But that's a little bit of a work in progress. So as of now, we are still doing the kind of the traditional subcutaneous dosing. So it'd be 1 shot and then 4 weeks later, a second shot. With the intradermal dose, my understanding is it's still 2 shots spread by 4 weeks. It's just a smaller dose. So that's a good question.
Okay, thank you.
Okay, any last questions? Okay, all right, everyone, be safe.